Rosacea is estimated to affect over 16 million Americans, according to the National Rosacea Society, and is often underdiagnosed by doctors. It's more common in fair-skinned women than men. Rosacea's telltale red blotches of the skin are also the cause of a lot of heartache for those who have it. To help us better understand rosacea and what we can do about it is Dr. Julie Harper, Clinical Associate Professor of Dermatology at the University of Alabama in Birmingham. Good morning. Thank you so much for being here.
Thank you for having me.
Doctor, let's talk first about rosacea. What are the symptoms?
Well, unfortunately, the clinical signs of rosacea are something that are very easy to spot. There's bright red erythema down the middle third of the face, so the forehead, the nose, the middle of the cheeks, the chin, bright red. Occasionally, not always, there are pimples in those same areas. People want to try to make this an adult acne. It's not, but pimples can be present.
So it can be a type of acne, if you will?
It looks acne-like to the patients, but there's definitely a difference. There are also squiggly little veins that you'll see under the skin, and those are called telangiectasias. So if I was trying to sum this up as a picture, it'd be those three things: redness, pimples, and telangiectasias.
What causes it?
That's a million-dollar question that I don't have the answer to that. We do know that, based on what we see clinically, based on what we see under the microscope, we know there's a lot of inflammation. Now, the harder question to answer is, where does this inflammation come from?
Exactly.
And we really don't know. There's been interesting research recently that looks like maybe people who have rosacea have skin immunity that's been turned on a little more than it should.
Does it get worse over time?
Well, that's another question that I think we can't answer specifically, at least not for every person. For most people, I would say yes, it does. But for the most part, yes, it's a chronic condition that without treatment can get worse over time.
I'm not sure if this is a fair question because we obviously don't know what causes it, but could it be hereditary?
Yes.
Yes.
The question is rosacea hereditary, or is the skin type hereditary? So we do have a tendency to see this more in that fair-complected individual, maybe even the blonde individual with blue eyes. They certainly inherited that skin type, and that's the skin type that we see rosacea in more often. And you can keep going down that line. Well, maybe that skin type is more susceptible
to it.
To sun, too, to sun, and we think that's part of where rosacea comes from.
Are there different forms of rosacea? Because I've actually seen some people with not too much and some people with a lot.
Absolutely. I think so many people, when they hear rosacea, they think of the big bulbous nose. That's the first thing that comes to mind, and that's not the most common type of rosacea. There are several different kinds. There's erythematotelangiectatic rosacea, which is just redness on the skin. There's papulopustular, which is pimples. There's phymatous, which is the big nose, or sometimes big cheeks or big chin. There's also ocular rosacea, so a lot of people don't know that. You don't have to have rosacea on your skin to have rosacea in your eyes.
I did some research before you came, and I want to read this to you real quick and get your feedback. In a survey by the National Rosacea Society, it says more than 76% of rosacea patients said their condition had lowered their self-confidence and lowered their self-esteem. I can see how something like that can happen, and I'm sure you've seen it.
Oh, absolutely. At the end of the day, that's why I do what I do, is people come into me. My patients with rosacea aren't sick and dying.
Of course not.
But they are suffering with a condition that is something that affects them socially. It affects them in the workplace. We know that people with rosacea miss more work than people who don't have rosacea, so absolutely, absolutely.
Well, we're going to talk a little bit more, so I want you to stay right there, Doctor. Thank you. And when we come back, Dr. Harper will tell us about what could be done to control rosacea and some of the medical breakthroughs that will no doubt play a big part in controlling it in the future. So keep it right there. Welcome back, everyone. Before the break, we were talking about rosacea, a skin condition that affects 16 million Americans. With us once again is Dr. Julie Harper, a dermatologist and founding director of the American Acne and Rosacea Society, here to answer our questions and broaden our knowledge of this life-altering chronic condition. Welcome back, doctor.
Thank you.
Let me ask you something. Can you suggest maybe basic guidelines that one could take to reduce flare-ups of rosacea?
Absolutely. We already talked a little bit about how important sunlight could be in worsening rosacea. So obviously, sun protection is a really important part of managing your rosacea. Now, if you can figure out how to get rid of stress in your life, go ahead and do that too.
Oh, well, if you know the answer to that one, let me know.
Right. That's a hard one. But if you can, those are the kinds of things that you're trying to manage.
Okay.
You can keep a diary yourself, because what triggers your rosacea may be different than what triggers my rosacea.
Great
so
idea.
Is it red wine for you? Is it hot spicy foods for someone else? So trying to find what it is that triggers your rosacea, and then trying to avoid those, or maybe trade out with something else for this, is a good idea.
Doctor, what about treatments? Are there any out there that can maybe help the situation?
Absolutely. We have many great treatments that are available. You can have an oral treatment, something that you take by mouth in the form of usually an antibiotic that we use. There are also topical products that are available.
Excellent. What about research? Any research lately that would, I guess, enlighten and maybe encourage people?
I'm encouraged as a dermatologist, because there's so much we need to learn still about what causes rosacea.
Sure.
And we are starting to get a more clear picture of that. And as we really understand the whole pathway of why you get rosacea, then we're going to be able to better target and treat those conditions, and then overall make rosacea better for people who suffer with it.
Thank you so much, Doctor.
Thank you.
Great
Pleasure.
information. It's been a pleasure for me. And if you have rosacea or you suspect you may have it, please visit the website rosacea.org.